Alrighty, so if everybody's finished with your test, we're going to go ahead and go on for continue the presentation, and at the end of it, then we'll pick up and take that test again just to kind of see what the difference was. So pretty much each year, 2.5 million people are diagnosed with venous thromboembolism, and this can lead to pulmonary embolism, which can account for as many as 10 to 25% of all hospital deaths. A lot of times, to prevent this, you can use sequential compression devices or heparin prior to, in our case, we're talking about surgical patients, so prior to surgery. And I don't know if it's been stressed, but the best time to do this prophylaxis is prior to the patient going to sleep. So ideally, you want that heparin given and the SCDs turned on in pre-op, not once we get back to the room, once the patient goes back to sleep, because it actually reduces the efficacy of it when you wait. Typically, SCDs especially, even though it needs to be ordered by a physician, it's still a nursing intervention, and nurses are often the ones that are either making sure that people are compliant or just making sure that they get on, say, for the surgical patients. So there are different types of them. Obviously, we have the actual sequential pumps, we have foot pumps, we have the stockings. There are all kinds of things. There are other, for other surgeries, they might want to use heparin as well. And once again, you want to do that before the patient goes to sleep. So a lot of abdominal surgeries, they will use heparin. So often the venous thromboembolism is preventable in surgery. If we do some of these simple steps, you can greatly reduce the patient's risk of having one of these complications. As we said earlier, we kind of went through it. The risk assessment that's kind of recommended right now, we're going to go over some guidelines here in just a minute, is the Caprini risk assessment model. And it's a little questionnaire you can kind of gauge. Once you get a certain score, it'll tell you based on the type of surgery they're having what type of prophylaxis is recommended for that patient. One thing that we found in this research is that both interventions, both heparin and SCDs, are highly effective. SCDs can be favorable though because you decrease the bleeding risk. With some patients, they're not going to tolerate the heparin well. Other thing you have to look at is if the patient has a heparin allergy. I mean, there are other options. You can do aspirin or one of those, but it's just something to consider. We're going to go over the guidelines. If you want to pull out your brochure, right there, if you turn it over to the back, you'll see it says recommendations and guidelines. These were taken from the Guideline Clearinghouse, and they're the ones they have for actually a lot of different medical issues and procedures and different things. They have just guidelines that are kind of set as to what they recommend. So prevention of VTE in surgical patients. First, they recommend using this Caprini risk assessment tool. If heparin is contraindicated and VTE risk is high, low-dose aspirin and or SCDs may be used. For a score of 0, the recommendation that they give is early ambulation. So for those patients, you just want to try to get them moving as soon as possible. For a score of 1 to 2, SCDs are recommended. 3 to 4, heparin or SCDs are recommended if bleeding risk is low. If the risk is high, SCDs only are recommended until risk decreases to a point where heparin can be safely given. So for joint replacement surgery, both anticoagulants and SCDs are recommended. Studies have also found that SCDs and heparin are highly effective, and like we just said, mechanical compression is favorable due to lack of bleeding risk. Obviously, for SCDs, there are contraindications for those as well, though. If somebody has a known clot that's active, you don't want to do that because you can mobilize it. Also, you'll see, like especially with trauma patients, you'll see that they have multiple abrasions or they have a cast on their leg or whatever, that you're not going to be able to put the SCDs on. So something else you can consider for that is foot pumps, which I'm sure some of you have seen, especially in ortho type procedures. they might use those, and they can also be applied after the surgery is done and not really maybe cause too much discomfort to the patient. So does anybody know, like just in your surgical experience, how much heparin do you typically give when? Okay, yep, that's good. So anybody have any questions about the guidelines? Okay. You can